it's 9 p.m. in RTD. It's time to English New Edition for tonight headlines. We have 31 new cases of the national response to the virus is strengthening. Public sessions of the first ordinary session in a reduced format in the National Assembly. For the international scene, first meeting of Security Council is discussed concerning the COVID-19. Welcome to our newsroom. The Secretary General of the Minister of Health, Dr. Salah Banoita Turab, has made a statement on Tuesday, 7 April 2020. The situation of the COVID-19 epidemic is as follows. 450 tests carried out, 31 COVID positive cases, 135 people under surveillance in the quarantine center, 71 cases under treatment. Today's 31 positive case will be sent back to the 2 treatment center. 9 people healed this day. The pandemic is still progressing in Djibouti. It is difficult to predict the further evolutions of the disease. This is why the mobilization must continue at the medical, social, and media levels. Also, in view of this worrying situation, the Ministry of Health, in agreement with the management of the Al-Rahma Hospital, has transformed the latter into the second center for the management of COVID-19 cases. Containment and barriers gesture must be scrupulously respected. To date, the accumulations of cases is as follows: 121 confirmed cases at COVID-19, 2,679 tests performed, 18 cases held, 0 case of death. Under the chairmanship of His Excellency Muhammad Ali Hummad, the second public sitting of the first ordinary sessions for the year 2020 of the National Assembly was held this Tuesday, 7 April, in the hemicycle of the Parliament, with as agenda the examinations of ratification of loan agreement relating to the financing of the COVID-19 response project. The sessions, which was held in restricted session due to the epidemic, was attended by Prime Minister Abdul Qadir Kamil Mohammed, 3 ministers and members of government of the Bureau of main permanent and special bodies of the national representations. In addition to members of the offices of the Parliament, the President of Parliamentary Group in this connection is at the end of the introductions of by the Speaker of the National Assembly, the words of Parliament and the directions of the Member of Government, as well as the concluding word of the Prime Minister and the Speaker of the National Assembly. The President of the National Assembly, His Excellency Muhammad Ali Hummad, indicated in his speech that the plenary session is all the more special as it takes place in a restricted form due to the health recommendations to avoid the spread of a virus that has caused and continues to cause in almost all countries of the world fierce health problem, financial difficulties, cessations of economic activities. It is in line with this sense of urgency and necessity that we are going to address the only item on the agenda, namely the ratification under emergency procedure of the loan agreement for financing the COVID-19 response project. The health situation that we are going through requires a change in behavior and requires us to comply strictly with the barrier measures advocated by our Minister of Health, and who we congratulate the Head of State Ma'mar Gelle and his government, who have taken adequate measures since March 18, including containment measures, the closure of the schools, university, and mosques, the banning of popular gathering, and the closure of international airport. Furthermore, I commend to all the investigation teams that are continuing their important work on a daily and unremitting basis. I also commend the communication carried out by the Ministry of Health every day through its press briefing. The Prime Minister Abdul Qadir Kamil Mohammed has for his part indicated that the health situations that we are going through requires change in behavior and requires us to comply strictly with the barrier measures advocated by our Ministers of Health and WHO. We congratulate the Health State and we have taken adequate measures since March 18th, including containment measures, the banning of the popular gathering, and the closure of the international airport. Furthermore, commend all the investigations teams that are continuing their important work on a daily and unremitting basis. The Minister of Health, Muhammad Warsama Diriye, has made a statement on the celebrations of the World Health Day, and he indicated that every year on April 7, the world celebrate our most precious capital, health. It in a context of unprecedented health crisis. This day offers the opportunity to take a step back and retrace the path traveled and the progress made, as well as the difficulties encountered. The year 2020 will not have been a restful one. The exceptional weather in November 2019 led to successive outbreaks of malaria, dengue fever, and chikungunya, which in turn tested our health system. The current COVID-19 epidemic has once again shaken the ice. Another epidemic is in a fragile context, an epidemic that mobilizes hundreds of men and women at the peril of their lives to provide the necessary care to infected compatriots. There are doctors, nurses, laboratory assistants, ambulance drivers, stretch bearers, and health workers, all commit to one cause: to put an end to the epidemic in our country. I would like to express our gratitude of those who, just as yesterday, have shown us their determination, strength, courage, and exemplary devotion in the fight against disease. In this time of pandemic, the cooperation China-Djibouti is taking part in the effort to eradicate this pandemic. The China Merchant Group today delivered large donations of medical and paramedical equipment consisting of masks. The large donations was delivered today to the Djibouti International Airport and received by officials from the Ministry of Health, Chinese ambassador to Djibouti, president of the Petroleum and Free Zones Authority. The donations arrived on board a plane chartered by Port and Free Zone Authority, which in turn donate equipment to the Ministry of Health worth more than 318 million of our franc. This action follows on from the outpourings of solidarity initiated by the President Ismail Omar Guelleh to eradicate spread of COVID-19 in Djibouti with a value of more than 318 million. The equipment includes 70 ventilators and 5 PQR systems and 15,000 diagnosis kits and 135 patient monitors and 135 syringe pump. The first batch has already been delivered on 30 March. The next batch is scheduled to arrive on 7 April and the rest in the coming weeks. Sea and air logistics are organized by the Djibouti Ports and Free Zone Authority. The Ministry of Health, through the Central Purchasing Agency from Essential Medicines and Equipment, known as CAM, has also placed under orders for essential materials and equipment in order to meet urgent delivery requirements. Maritime and port logistics have been provided, arranged, and organized from start to finish by the Djibouti Ports and Free Zone authorities. In order to has placed a large orders for protective equipment, including 100,000 masks and 300 PPA, 200,000 gloves, and all this essential equipment will be delivered to Djiboutians. The Minister of Health, Mohammed Wassamadiri, has thanked the Chinese merchant group and recognized the effort continue every day, and we will report on the distributions of a fairly regular basis in the faces of increasing number of emergencies. The health workers are continuing for their labors hit hard by the economic crisis caused by this pandemic. As part of the humanitarian and social response to precautionary and prevention measures against the COVID-19 pandemic in Djibouti, the Ministry of Social Affairs Solidarity, in collaboration with the Ministry of Interior and Secretary of State for Decentralization, has since 25 March been conducted food distribution programs for the family affected by the distributions. The mass has targeted more than 4,000 families represented in about 14 neighborhoods in the municipality, such as Arhibas, Neighborhood 7 and 7Bs, Ambuli, Jebel, Anglais. For example, for the Balbala municipalities, 8,000 families have benefited from distributions representing 25 districts of the municipality, such as Balbala and Sheikh Musa Hayable, Pika 12, Harirad. Thus, today we gave a total of to 12,000 families affected in Djibouti by social workers who have been carried out by the UNFD, which is about 3,000. A national coverage of 16,000 families has been reached. The increasing numbers of emergencies, the economic crisis caused by the pandemic. The consultations meetings with the economic operators and the Minister of Labor, as well as the Secretary General of the Minister of Equipment and Finance, the objectives being to find out the difficulties encountered by this economic operator during this period of containment. The representative of the member state proposed solutions to offset loss of earning of these companies at a time when the containment is having a major impact on the hotel, travel agency, and tower operator sectors. For their part, the operators have taken the opportunity to offer their contribution to the representative of this center. This morning, the Center for Leadership and Entrepreneurship has hosted a consultation meeting with the banking and the financial sector under the chairmanship of the Minister of Economy and Finance responsible for industry, Ilyas Musa Dawale, and in the presence of the governor of the central bank, Ahmed Osman. The purpose of the meeting is to find out from local banks and insurance companies about ways and means of jointly dealing with the socio-economic impact of the COVID-19 health crisis and above all the contribution which financial institutions can make to companies and customers affected by the pandemics. After the words of welcomes of the minister and the governors, the leaders of the banks and insurance company intervened to present the measures proposed to accompany company and customers also submit their grievance to the state to face this crisis. Bank directors insisted in particular on the needs to temporarily adapt banking regulations during this period of crisis and undertook to propose measures to support companies and households in difficulties. The Minister of Finance, Ilyas Musa Dawale, called on the banks to support businesses and private clients during this crisis. He congratulated the leaders present on the measures participating by the banks to deal with COVID-19. He stressed that the authorities would soon be proposing support measures through the Djibouti Partial Credit Guarantee Fund on the basis of an inclusive dialogue with financial institutions. As part of the fight against the COVID-19 pandemic, the Minister of Higher Education and Research, Dr. Nabil Mohammed Ahmed, accompanied by the President of University, Dr. Jama Mohammed Hassan, and the technical advisors, Dr. Fahmi Ahmed Mohammed, visited the university's Fab Lab to find out about initiatives carried out by students. These include the manufacturers of face masks, also known as a protective visor for health practitioners, and ultraviolet sterilization device. A third initiative to manufacture respiratory equipment is also underway. For his part, the Minister of Higher Education, Dr. Nabil Mohammed Ahmed, congratulated and encouraged these initiatives, which will be very important in the fight against the virus COVID-19. Following the example set by the President of the Republic, Ismail Omar Guelleh, who was the first contributor of this solidarity, the Djibouti Freight Forwarding Associations, the Wasil Group, DICO Meuble, and TCD have all handed over today in the forms of checks for their contributions to fight against the COVID-19 pandemic. Djibouti Freight Forward Association, which has contributed of this was a group paid out of 7 million of Djibouti franc. DICO furnitures 5 million. Finally, the STCD 5 million. This legendary surge of solidarity by Djiboutians is launched even in the working class neighborhoods, with committee working to raise funds for COVID's fight. For the international scene, news from around the world. First meeting of the UN Security Council on Thursday. The UN Security Council will hold its first meeting on the COVID-19 pandemic on Thursday. Its 5 permanent members, among others, have been prevention for weeks about holding a session last Thursday, and 9 out of 10 non-permanent members had formally called for a council sessions on COVID-19 with a briefing by UN Secretary General Antonio Guterres. France has been trying since last week to organize a video conference on the leaders of the 5 permanent members: United States, Russia, China, France, United Kingdom, to try to iron out differences, and preferred that it be held before meetings of the 50 members of the Security Council. This is it for the news. Thanks for watching us.